Imagine if somebody you knew was diagnosed with ALS. Diagnosis doesn't just affect the individual, it affects everybody around them too. Promote awareness, get involved, educate yourself so that we can find a cure for this devastating disease. Make life a possibility for those with ALS.
Motor neurone disease, MND, is also called amyotrophic lateral sclerosis, ALS, and Lou Gehrig's disease. MND often begins with weakness of the muscles of the hands or feet. Motor neurons are nerve cells that control the voluntary muscles of the trunk and limbs, and affect speech, swallowing and breathing. Damage to these nerves causes muscle weakness and wasting. This leads to gradual paralysis, loss of speech, difficulty swallowing and eventual death from respiratory, breathing, failure.
So I understand that your area of clinical expertise is very patient-centered, using mostly qualitative research rather than quantitative. This is a pretty major shift from traditional methods of research. Why have you chosen to use quantitative?
There's a lot of research that's going on worldwide and trying to understand the underlying mechanisms of why a particular gene not working properly causes muscular dystrophy. There are huge efforts on in clinical research trying to find gene replacement or exon skipping, for example, in Duchenne muscular dystrophy. But what I've noticed in my clinical practice is that patients and their families are still looking for ways to live with a muscular dystrophy. They're looking for answers to other questions about how they participate in work, home, socially, and a lot of our very traditional research doesn't address that. So the qualitative research allows patients and families to participate. We use different methodologies that invoke the use of cameras such as photo voice, interviews or focus groups, and what that does in a lot of ways is expose patients' experience or individuals and families' experiences living with some of the challenges that they have. And so I think about qualitative research as a way to uncover questions or challenges that as a healthcare professional I didn't think about. Mm-hmm. And then that will form the basis for further quantitative research.
There have been 27 players diagnosed with ALS in the past 60 years. More ALS patients than that, who never played football, will die in the next 2 days. The question of whether I would play football again is a popular question. But would I give up my wife, Michelle, or our son Rivers? In some way, football brought me to them. And tell me what my life would look like in detail if I had not played football. Would I have gone to college? Would I have found something passionate and meaningful to do? Would I have made an impact on others? The simple answer is this. Right now, I am happy. My life is not easy, but it's awesome.
When you see yourself 6 months ago talking about ALS and about your friends and about how you're dealing with it, what are you thinking when you see that now?
I think how lucky that guy was at the time.
How do we end up sitting here with video cameras and microphones set up and
I mean, we've talked for a while about making a video. I want people to know what it's like, and the good and the bad. You know, why is this 20 young looking person being rolled around in a wheelchair? It's a lot of questions in people's heads that they don't want to ask.
How How long has it been since you were diagnosed?
It feels like it's been forever, but it really hasn't been that long. A little over 2.5 years since I've been diagnosed. And I've had symptoms for probably 4. You know, there's been a lot of really drastic changes over the past 6 to 9 months. To eat, to go to the bathroom, to brush my teeth, absolutely anything I can't do on my own anymore. The most thing that's noticed is my voice is a lot different. It keeps getting worse. And now, you know, the ability to communicate is being threatened. And that's really scary.
To raise awareness of this disease, and specifically to help other people with ALS to live their lives as best they can.
Communication is a key element to our quality of life. The eye tracking technology runs on Windows, and Surface was the latest product we have discovered where it was enabled.
All day he's on his computer, whether he's tweeting or he's speaking. It's powerful enough for him, which is huge. I think fatherhood means almost everything to Steve.
Rivers, are you showing off?
With Rivers, it's created a special bond that many fathers and sons will never have.
He's able to get some physical time with Rivers because he'll climb up on his lap. Steve, when they're watching movies together, can talk back and forth to Rivers about what's going on. And the time that he has with Rivers on his lap, I think it's safe to say, are his favorite times.
They say your eyes are the window to your soul. I suppose this means that technology allows me to bare my soul. Although I'm hopeful for a medical cure for ALS, I have always said, until there is one, technology is my cure. This is my lab, my favorite room, where I get to show off. We installed automation in the house, so I'm able to control lights, fans, doors, and all of our electronics.
Before losing the ability to speak, Gleason recorded thousands of words and phrases. Using retinal scan technology, Steve can communicate through a computer, one letter at a time. Incredible though it seems, the man who's lost almost all of his abilities has managed to keep his sense of humor.
Benny, here on camera, do not this up.
ALS doesn't just kill you, it shuts you down, little by little, bit by bit.
It starts small. Maybe it's holding a pencil that gets difficult.
Or getting up from your chair.
Then you find it hard to turn the pages of your book.
Because you can't move your fingers.
Your mind keeps working, but your body doesn't respond.
You won't see it coming because no one knows where it comes from.
Soon you can't hug your mother or pick up your child.
You won't be able to tie your shoes.
You don't need to tie your shoes because now you can't walk.
You can't eat or shave.
Or laugh or sing.
First you can't catch your ball, then you can't catch your breath.
ALS doesn't just kill you.
It steals your life, a little bit at a time.
And it doesn't stop until there's nothing left.
Unless we stop it first.
Unless we stop it now.
I'm Steve Gleason. Let's put our heads together and find a cure for ALS.
Because ALS research is underfunded and under-resourced, patients have had no option but to fade quietly and die. That is not okay. That is not okay.
And what are some things everyone else can do? So people like us, students, anyone in the community.
Just enjoy what you have lived and what you are doing.